Hello everyone, welcome to my YouTube channel. Right, I'm going to be doing a presentation on a question regarding American Society for Clinical Pathology exam. Okay, this is a question, okay, and this question is going to do with hemolytic disease of the what? Fetus of what? Newborn. Okay, happy days. Before we continue, my name is Dr. Emmanuel Lo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. Let's look at the question. So this is a question now about HDFN, which is hemolytic disease of the fetus of what? Newborn. Okay, right. So which maternal antibody is most commonly associated with severe HDFN? Okay, right. Let me give you a little background about this. I actually have videos on this as well, so you can actually look out for that. Okay, now when you look at that, I'm going to just give you a clear picture about it. So I want you to think about a patient, a woman that is pregnant, because when you say hemolytic disease of the fetus of the newborn, that means it's a fetus. Okay, a woman is pregnant. That's what it means. Okay, a woman is pregnant. Okay, and now because the woman is pregnant, something may have passed from the woman, okay, to the baby. Does that make sense? So if a woman, for example, has an antibody, okay, now that antibody that woman has developed need to be, if the woman that is pregnant has antibody, okay, floating in her system, we need to monitor the pregnancy very closely to make sure that there won't be HDFN. But sometimes it can still occur, whichever way. I think I have a lot of videos on that, so you can watch it. So, but the point I want to make is that antibody may pass from the woman to the baby. Okay, so what that antibody is going to do now is to attach on the baby's red blood cells and then begin to hemolyze the baby's red cells. Okay, that antibody in the baby's mother that has passed on the baby's red blood cells and attach itself on the baby's red cell and begin to destroy the baby's red cell is what we call hemolytic disease fetus of what? The newborn. Does that make sense? Okay, so the reason is that the hemolysis there is occurring in that fetus or the newborn because the antibody has passed from the mom and has the antibody is now attached on the baby's red cells and begin to cause hemolysis. In other words, begin to cause destruction. There are a number of antibodies that can do this, by the way, many of them. Okay, many of them. But anyway, I'm going to stay with the answer to this. Okay, the question to this is which maternal antibody is most, not the word most common. It doesn't mean that there cannot be other ones that can do it. Okay, there are many of them actually that can happen, that can do that. Okay, but most common one is anti-D. That's just the answer to this question. Okay, so the most common one is what? Anti-D. So anti-D is the most common associated antibody that can cause severe hemolytic disease of the fetus of or the one newborn. Okay, that is anti-D that are most commonly associated, but there can be other ones that can do it, by the way. Okay, most of the clinically significant antibody is definitely going to do that. Okay, whether you are looking at anti-little c, anti-big C, anti-big E, anti-small c, anti-small e, anti-Duffy A, anti-K, all of them will do the same thing, but the question is most commonly associated. So the one that is most commonly associated is anti-D. I hope I've answered that question. Okay, right, happy days. So, and before actually I wanted to say thank you so much for listening, but before I actually go ahead with what I'm going to say, can I also mention that one of the ways then, if that baby is then born, what is going to happen in a case where there is that hemolytic disease of the fetus of the newborn, the baby is going to be high, there's going to be high jaundice. Okay, the person bilirubin is going to be very, very high because of the increased rate of the destruction of the very red blood cells of that very baby. Okay, so the bilirubin is going to be very high. In fact, in most cases, what we now need to do is to do what we call exchange blood transfusion. Okay, I have videos on that. All right, now, and what you are going to do as well, just in case, I don't know what you are going to see when you go for your exam, but I want you to know that another way you can confirm this is that the DAT is going to be strong positive. It's going to be positive. DAT will be positive, which is direct antiglobulin test or direct Coombs test is going to be positive. Why is it positive? Because direct Coombs test is measuring the presence of the antibody on the surface of the red blood cells, okay, which I've already explained on my previous video. Okay, so that antibody from the mother that has attached itself on the baby's red cells, so that direct attach of that antibody on the baby's red cell will be detected by what? DAT. IAT, that means indirect, is likely not to detect it. What will detect it is what? DAT. 80. So one of the ways to also confirm this very hemolytic disease of the fetus or the newborn is what? D80 what will be what? Positive. Just in case you go for this exam and they twist it a little bit and the D80 is positive, just know that that's what is also communicating. I hope that makes sense. Anyway, thank you for listening. Please feel free to ask any question, and can I ask you to like, share, subscribe, and comment? Do your best to subscribe if you've not done so, and comment as well. I want to see what you think about the video, and please share. One of the ways to appreciate the effort in making the video is to subscribe, like, share. Thank you so much. And obviously, feel free to contact Two Good Consultant. We are here to help, whether it is for your interview preparation or exam preparation or your academic or your support career. Whichever way you think we can be able to help you, we are here to help you. Anyway, thank you so much, and I wish you all the best till I come back your way again. Happy days. Bye.